So the next paper is on ethical issues in post-disaster clinical interventions and research by Dr. Athula Sumathipala.
Mr. Chairman, Mr. Chairman, may I ask for your permission to do my talk? Thank you very much for the opportunity given. I just have to warn you in advance, I am wearing my Sri Lankan hat for this presentation because it's important, particularly because I actually coordinated the post-tsunami psychosocial work in Sri Lanka after I was invited by the Sri Lankan government to lead the psychosocial desk at the National Center for National Operations following tsunami. Just to show you that what we are presenting here today is not just fallen from the sky, it's grounded within the work we carried out. And in fact, my colleague here and our research group abandoned all our research temporarily and volunteered to coordinate that. And I gave my London job for 10 months, and we did things voluntarily. So that's the background to this presentation. On behalf of working group on disaster research, it's a multidisciplinary group with expertise in ethics. And it's important again to show you who the actors and players are. You know Daryl who is here. Leo, Amar, Jeffrey, all of them are here. And Nandini Kumar from India, Asim Ahmed from Pakistan, and Fatima Singh from Sri Lanka. Cesar, who is a physician who also coordinated the psychosocial work full time. Sukaryo from Indonesia, Chandra Jayasekar and Priyakar, both of them have got their MScs from Monash Bioethics, and this is the background. Next slide. In fact, we invited some other colleagues from Sri Lanka, and some of them had other prior commitments. People like Prof. Fernando could make it, but we will involve the other colleagues in Sri Lanka who have the expertise. And the work was funded by the Wellcome Trust. It's very important to know the process, again, as I mentioned, and because these were not done behind closed doors. And we had a very large disaster research and ethics meeting in Colombo in January, which we involved the government. You can see the Honorable Minister of Disaster Management, the National France Foundation, the universities, and the resource people. It was part of the work I am presenting today. It's like this. And we had the inauguration, Prof. Fernando is there, and we had a large audience. This was partly a public awareness raising program as well. And we also had a basic and advanced course on bioethics and under the title of ethics as a friend of research, because we discussed here the polarization of ethics on one side and research on one side. We wanted to show that these two are complementary things, not opponents. And this is the critical mass we trained in the basic course and advanced course, because we had a basic course the previous year, and this is the critical mass we trained. So that's one of the ways of awareness raising. And after that, we had very intensive discussion, debate for 2 days. The close group of experts from the region who were working within the field of ethics. So we had very intensive discussions, briefings, reporting back, and which continued actually up to now through emails. And you would see in the page 36 abstract, I'm not going to present the whole thing, I'm going to pick up few things. And it's very important to tell you why this meeting and the draft and how all this came into being. As we know, if disaster research is important and can be done ethically, why would we have to come out with draft guidelines? Why would unethical research take place? Partly unintentional, due to lack of awareness, not sensitive to the specific ethical issues, and does not consider ethics as part of essential components of research. So that is what we call ignorance, which has to be defeated through awareness raising. But the most dangerous part is the arrogance, intentional, conflict of interest, exploitation of vulnerable survivors deliberately for easy and cheap research, and lack of respect for survivors. Next slide, Swin. And unfortunately, tsunami was a very good ground for parachute research and exploitation. I have left this booklet there, people can pick it up. Very briefly, there was a Japanese group collecting blood in one of the camps in one of the down south, where we had to put a stop to collection of blood, but they managed to smuggle some of them, and in fact there are abstracts coming up on those research. Although we stopped, unfortunately they got hold of a research ethics committee chairman who got his son to apply, and they gave expedited review. And the alarming thing was the Japanese team annexed ethical clearance which was taken in 2003, tsunami happened in 2004, as evidence for sponsoring country review. I wouldn't go into details. This was discussed in Indian Council for Medical Research workshop. All the attendees agreed 100% that every basic again Swedish collecting blood data from survivors in the camps after taking permission from police. I am sure that doesn't happen in Sweden, and I can go on, and this happened in Pakistan, this happened in Philippines. Next slide. And again, it's not only ethics in research, as my colleague mentioned about the clinical ethics. Large number of foreign organizations and individuals came without any understanding whatsoever within the context of humanitarian aid, and I had to speak to people who were French, who couldn't speak English. They came to do counseling. So, what did we agree in this particular meeting held in Colombo among ourselves? We agreed that disasters happen and all the destruction, death, disease, displacement, disappearance, distress, all this happen. Every of this has its own ethical implications and issues. So therefore, we felt that post-disaster research is important, and we have disaster planning and prevention, evidence-based management. Next slide, please. In fact, it may be unethical not to conduct research in such situations, since ethical research that takes into account the needs and priorities of affected communities must be encouraged and promoted. We agreed on that. However, it has to be performed in an ethical manner, planned preferably well in advance, particularly if the disasters are recurring. Research proposals should be carefully scrutinized for the level of risk and the significance of proposed research. Such scrutiny may result in need for additional procedural safeguards, particularly because people are vulnerable. And there are concerns that research had been carried out without proper scientific rigor or ethical standards, both, particularly during planned exploitative international collaborations. Next slide. When research is combined particularly with aid, relief, at times clinical care, there is undue inducement for participation in this vulnerable population. I want to reiterate the word vulnerable. I'll come to that. Why? Additional safeguards are needed to protect the vulnerable as well as to facilitate high-quality research given the nature and scale of disasters and the complexities of the issues related to health care and research. The therapeutic misconception my colleague mentioned is very important. Participants should be made very clear whether this therapeutic intent or whether it's pure research to reduce the likelihood of participants mistaking research for clinical care. Next. The global divide and disparity is that already exist within societies become more exaggerated in disasters, especially in the developing countries. But we saw this in New Orleans, where the maldistribution of resources, whether it's a developed country, but particularly in developing. Disasters by their very nature result in vulnerability in individuals and in societies. We want to stress that because the meeting held after 9/11 in New York Academy of Medicine, sponsored by them and National Institute of Mental Health, felt that disaster-affected survivors are not necessarily vulnerable because of the asymmetry of knowledge and authority between the researchers and the participants, particularly in the developing world. So these issues should be equally, if not more important for the developing world, and we appeal to the international research community as well as to ethicists. They should take serious concern and look at it and do something about it. Next slide, please. Few more slides. Existing guidelines and norms pertaining to research on human participants may not be sufficient to address all these situations, and therefore greater vigilance is necessary in disaster-related research to ensure that the general ethical principles are adhered to and participants are protected. We admit that there are accepted national and international guidelines, but in addition to them, we urge researchers to pay particular attention to following ethical principles when conducting research in disaster-affected situations. These guidelines are meant to supplement and the relevant existing national and international ones. disaster setting, we don't think it justified doing it under disaster situation because that is not disaster specific. So that's one example. Again, informed consent and voluntariness, survivors of disaster situation are particularly vulnerable. We stress that particularly in the developing world by definition, we think it should be. And again, the requirement for research on children affected by disasters cannot be ruled out. However, due to their greater vulnerability, the researchers will have to justify the need to use children as research participants. The informed consent process will have to incorporate mechanisms of proxy consent by their parents or guardians, that is additional safeguards. And again, on exploitation, the selection of research participants must be made on scientific reasons and not based on easy accessibility, cost, gender, malleability. Next slide, the final one. Ethics review, we admit clear, but it should be an exceptional situation, but should be conducted with extreme caution. This expeditious review must follow the standard procedures, considering the guidelines mentioned above, but and dissemination of results we believe should be in open access journals, because when we map all the research, it finds most of the disaster related research is available in non-accessible journals, and international collaborations have to have a local partner, although it's the case in other things, but particularly in disaster situation. I think that's it. So what would happen next? We don't claim this to be a universally acceptable thing coming from the developing world. We don't do that. That's why we are here to present it to you. We are circulating it. We are going to many stakeholders, organizations, individuals, experts. We want to develop consensus and come to a guideline which can be implemented and followed and respected by people, particularly in our part of the world. Thank you very much for listening.
Thank you. I have a few more questions. Okay, very brief, please.
Thank you, Athula. I was involved with the team, so we need to take these guidelines forward. As Athula just mentioned, that this is not a final document. The next step is for us to gain input from the rest of the wider research ethics community, from people who are stakeholders, etc. So these guidelines have been included in the abstract book that everyone has. We would like you to actually go through it and give your input regarding all the points that we have included in these guidelines. Obviously, this was a rapid 10-minute presentation in which everything could not be dropped. Just give us what you feel is your take on these guidelines, which are meant to supplement existing guidelines, not replace them, and supplement them in disaster situations and research. And send these comments back to Athula. Because we need all the input that we can get, and so that we can evolve something that is acceptable at a wider level.
Just what you have put together, Dr. Athula, you and your group, is this for just natural disasters, or how did you define disasters?
We have actually defined it in the abstract. It's not only for natural disasters, and again, we are not saying this is exhaustive, it has to be evolved, but we consider it can be taken for
man-made disasters
as well.
like war, etc.
And I personally believe every disaster is man-made, and then, anyway, it's not natural.